Welcome to my world. I like to play a little clip whenever I attend any massive venue of this size, in particular appreciating a lot of you from around the world and don't necessarily know who I am. And so that's me, the educator. I'm also a clinician, of course. The real meaning of doctor as a derivative, Latin term, really means teacher or educator. And I pride myself on my ability to be able to do that and share my views with the masses. And I got to say, and I haven't been here all week, but I do believe I may have some solutions. I think we got to GMO some cows and send them over to Norway to swim in the waters there, fueled by a hot air balloon and biofuel only. What do you think? Maybe? All right, I got to find my clicker here. Do we have a clicker to go slide to slide? And while we do that, so I'm a practitioner in Toronto, and I'm also a television host, as you've seen. My passion is nutraceuticals. I feel like this industry at large is up and coming. Natural medicine at large is up and coming. And I believe wholeheartedly that where we still, for some reason, fail to look at are the oceans, where there are just a wonderful plethora of undiscovered nutraceutical, vitamin, mineral, nutrient compounds that we probably don't even know exist, antioxidants, et cetera, that we can likely manufacture and encapsulate to our advantage. You can't get me more passionate than fish oil. So that's in large part what I'm going to be discussing today. And I call it nature's panacea. I mean, of course, there's no such thing as a cure-all, but I believe wholeheartedly that it's probably the closest thing to a cure-all because it's not for one thing. Of course, fish oils can manage and help us with a tremendous amount of what ails us. Am I going to be cueing you guys to go through this? That'll be real tedious. My bad, I'm sorry. It's under the podium here. Thank you. All right. So nature's I was also told it's hard to keep me in one place, by the way, because I like to jump around. And I was told there wouldn't be a podium, but I'm going to be stuck here at the mic. And so to get to the next one, I'm just pushing this green button here. All right, let's hit the next slide, guys. So nomenclature revisited. I mean, this whole world of natural medicine, and the terminology that gets thrown around within it often bewilders me. What we consider conventional medicine, that which we consider first-line therapy, or what we do first and foremost when we have a problem is visit our doctor for consideration for drug or surgery. How about we flip that around? How about we consider drugs and surgery as the alternative? Redefine and rename the alternative as what we now consider conventional. So to be clear, I believe wholeheartedly that alternative medicine, that which we define by things that come from nature, employed in a complementary manner, my world, is redefined as conventional, as first-line therapy. And a perfect context for that would be to imagine fish oil and those ingredients that come from the ocean. I mean, this should be our first-line therapy. And then the alternative becomes the pharmaceutical drug and or surgery that you may need if you run into a severe problem. I hold mainstream medicine, by the way, in highest regard, but I believe wholeheartedly that conventional medicine is now the new alternative. And one of the reasons why I believe that is because of the incredibly long list of side effects that we have within our pharmacopoeia. And often you do need pharmacopoeia. Once again, I'll reiterate how high regard I have for the pharmaceutical industry. But the problem herein lies that within one taking of one drug, you're at about a 33% risk of a side effect. 2, and you're up about 50%. 3, and now you have about 75% likelihood of a significant crossover or side effect. The only thing we can say about fish oil is that you have a multitude of side benefits. Okay? Inflammation, this is a bit of a sub-theme, in particular in this delivery, but we have to identify and acknowledge inflammation as the underlying cause of any and all disease. I mean, at the molecular level for sure, but we are now recognizing this medical buzz term of the day, inflammation, as lined with cardiovascular disease, underlying to cancer. It's pretty much responsible for whatever ails you, rheumatological issues. It is the thing that triggers the genes that lie deep within your DNA aptitude and tells them, turn on, those negative genes that mom and dad have dealt you. And if you dampen or keep inflammation at bay, those won't turn on. And that's exciting news. So this is the top 20, this is might be a little bit hard to see in the back there, top 20 drugs sold in North America, sales, and they are all indicated for inflammation or controlling of cholesterol or cancer. Or at least most of them are. All these guys here are for cancer or for inflammation control. It's pretty alarming. 90% of people, including in this room, whether you supplement, who's supplementing with fish oil here by raise of hands? Okay, good. Well, I'd imagine more of you would be in this population, but you're, up in and around, the population percentage, which is about 50 to 60% of people supplementing with fish oil specifically. But even if you are supplementing with fish oil, you are still deficient. We'll talk about how you can actually check for that as well. So is it really a panacea? Well, it literally could be if we consider that it does control all of those things for which most of the top 20 drugs in North America are controlling. 40 years of omega-3 research. I'm preaching to the choir, rather. Over 19,000 studies, over 2,000 double-blind, placebo-controlled, randomized studies. There's no more arguing whether or not fish oils should be taken by everybody. So hopefully at some point next year at this convention, if anyone were to ask you, it would be 100% of you taking it. And not necessarily all of you at your endpoints. We'll discuss again how you know whether you're taking enough. So this was a study done, Harvard University. 6th largest preventable cause of death is low dietary omega-3 fatty acids. High dietary trans fatty acids, by the way, came in 7th. Everyone read that? This is another potential panacea on the market. I haven't tried it yet, but I hear good things. How many people are taking this one? Due diligence. So I'm not just an educator. I'm not just a clinician. I do travel the world and ensure that I'm stepping into manufacturing facilities, wherever these things are conjured up, from research centers to where they are produced. Farm to finish is what I like to call it. This is me actually through Ascenta here in Halifax, looking at their production line. I hope I'm not giving away any trade secrets by showing these slides. The clinical benefits, of course, I could be here all day to talk about the clinical benefits, but I will focus very briefly on heart and brain, where most of our minds are at, and as it relates to inflammation. So if you imagine that compared to people that have less than 4% in their red blood cells of omega-3, EPA-DHA, those that have higher than 8% have a 90% less chance of heart attack, death from heart attack. So if you have a higher than 8% red blood, by the way, dolphins have about 17%. I mean, they eat a lot of fish. But if you have a higher than 8% in your red blood cell, you stand a chance of 90% less chance of having a heart attack. That's pretty amazing. So the heart, what a wonderful organ. What does 2.5 billion represent as it relates to the heart? Any ideas? Just shout it out. 2.5 billion. The amount of beats in a lifetime. Very good. That is a lot of work. So taking EFAs, essential fatty acids, omega-3, DHA in particular, helps to reduce the risk of sudden heart attack, as I mentioned. Most studies show by about 50%. It also decreases because of its ability to reduce viscosity, increase viscosity rather, and thin your blood, so to speak, the amount of beats per minute. Reduces arterial stiffness, peripheral stiffness. Reduces the risk of arrhythmias by 38%. Decreases serum triglycerides by up to 50%, blood pressure by a significant margin. Studies to show that compared to antilipidemic agents or statin drugs, fares better. Effective overall statin drugs and mortality, overall mortality. A very impressive roster. You can't read that in the back. It says, my doctor says oily fish is good for my heart. I'll have the deep fried seafood platter, please. Okay, so not only the amount, of course, it's quality, it's also, source, and it can never come from diet. And these studies are really even looking at amounts that are subtherapeutic, in my opinion, the opinion of leading experts. $100 for anyone who can guess the correlation between these two pictures, these two species. Shout it out. Any idea? The hummingbird and the diamondback rattlesnake? And it's not genetics, by the way. Speed. DHA, yeah, well, that's a spoiler. DHA, why DHA? Well, in the rattlesnake, it's flipping around all day, every day, warning its prey. And the hummingbird, of course, its wings are fluttering around like mad. Deep within the tissues, the muscle tissues of each of these species, lies a very high concentration of DHA. Why? Because that molecule also spins around molecularly and acts to be able to provide those muscle tissues with their ability to contract at such a rapid pace. Your heart does the same thing. That's a miracle of DHA. For the people at the back, I want you to switch from motor oil to omega-3 fish oil. Of course, when the Tin Man got his heart, that was a necessity as well. DHA is such an imperative thing to the beating or the rapid movement of any muscle tissue in the body. So a real quick story here. It's a true story. A lot of funny stories as it relates to patients who will always never be named. That's an oxymoron. So this old Italian woman presents, and she's got abdominal pain. And before we figure out or diagnose exactly what's going on, because no one has been able to, often one of our first go-tos, because it's relatively risk-free, is a castor oil pack. It tends to provide some degree of reduction of inflammation. If we imagine this is perhaps superficial or it's fascia-related, and I imagine it to be a bit of a sprain. So I asked her to take castor oil and put it on some flannel and apply it to her abdomen and go home, and we'll figure this out, but we'll see you tomorrow. She comes back and she says, I think I already immediately feel some difference. And I said, okay, that's wonderful. I want you to continue to do this for a couple of weeks. She comes back a few weeks later. She presents with this dark black abdomen. She says, I'm a miracle worker because whatever, she's going to tell everyone, all her friends about how wonderful this was. I look at her abdomen closely and I actually see an imprint of a shopping bag. It was a Dominion logo on there. They're supposed to wrap with, of course, using saran wrap to keep the castor oil down, 15 minutes. Anyway, I said, what the heck have you been doing? And she said, just what you told me, like in a bit of an accent. I used castor oil on my abdominal. Yeah, I got to be real clear about that in the spelling from now on. She was using motor oil on her abdomen, okay? And it worked. Goes to show you the power of placebo. Should have been causing more harm than good. As it relates to the brain, MRI findings of lower brain volume in those with omega-3 index, less than 4.4%, in fact. That's the magic number. Less than 4% in your red blood cell seems to be a problem. Represents a change equivalent to approximately 2 years of an aging brain or structural brain aging. 2 years difference. What does 1.5 billion represent as it relates to the brain? Neuronal cells. Hopefully we have a few more than those, the smarter of us in the room. But close. We have trillions of cells in our body. A lot of them are in our brain. But no, 1.5 billion is the amount of thoughts, on average, that a human will have in their lifetime as well. We have a lifetime theme going on here. 1.5 billion thoughts. And DHA, we now know, it's not just a structural molecule. It also represents neurotransmission capability. The vesicles that deliver serotonin, dopamine, all the feel-good hormones in our brain, the very ability of our brains to be able to think and exchange information relies wholeheartedly on DHA as well as EPA. Improves symptoms of ADHD. We've known this for some time. Depression in both children and adults. It's lower in people with dementia, of course, and depression. Reduces the risk of suicide. Consuming it weekly in a relatively fair ratio of 1.5 to 1 EPA to DHA shows lowering the risk of Alzheimer's disease by about 60%. Not as impressive, by the way, a teaspoon of turmeric or even mustard does up to about 20 or 25%. Reduces the risk of suicide, as I mentioned, as well as postpartum depression. And long-term low levels are also related to the increased risk of depression. The gut, 168 million. What does that represent? Bacteria, there's a lot of bacteria in there, and many of which we have no idea as to what they're for. Of course, many good and friendly ones we now are realizing have everything to do with the psycho-neuroendocrine immune system. But 168 million is the amount of liters of blood that will move through your organs in a lifetime. That's a lot of blood moving through your organs. And you want that blood saturated with EPA and DHA. And here's why. It not only reduces the risk of cancer, but also the progression if there is any. And for everybody in the room who already doesn't know this, we all have cancer flowing around our system. EPA, DHA is also, surprisingly, very important for the first-line immune defense system in acknowledging that fact and getting rid of it when it encounters it. There's moderate evidence to show reduced risk of lung cancer, limited for pancreatic, but very strong for breast. And a lot of this has to do with mitigation of inflammation, by the way. Colon cancer, some moderate evidence there as well, and prostate cancer. And the latest, you've heard the buzz, I'm sure this has been covered this week, about prostate cancer, just a really poorly done extrapolation of the data and literature, sort of miscontrived. So if you're trying to mitigate cancer, don't worry, you can still have your drink, as long as it's only 1 for women and 2 for men at night. So long as, of course, it's a fish oil martini. Aging. What does 10 represent? You should get this. Now that we're for lifetime here. 10. Any guesses? The amount of years you could probably put on your life by keeping a saturated fish oil concentration through your veins. EPA, DHA, let's say that. Okay, it doesn't have to be fish, but an EPA, DHA level of 8% or higher. We'll talk about that. It's caused by, of course, free radical damage as well as telomere issues. The telomere shrinking faster than it should. It's the fuse at the end of a bomb, if you will, of your cells are supposed to live approximately 50 cycles or turnovers, and if they're living shorter, they can possibly turn into cancer. We want them living longer, but more stable. EPA and DHA, in fact, slows down the shortening of the telomeres. So influences telomerase, the enzyme that's in charge of this process. It reduces free radical load, essentially, again, by managing the inflammation that is the root cause of all disease. It also reduces photoaging, wrinkles, as well as the chronological aging associated with that. So I'll tell you about the 24,000 number in a second. Here's the most exciting thing, I think, in nutritional or nutraceutical medicine today. And it's called nutrigenomics. So we now know, of course, the human genome is, well, there you go, 24,000, in number. We thought it was a lot more than that. Guesses were about the 1.5 million down to about 100,000, now 24,000. Not so far off a banana, by the way. We're 60, 70% like a banana, genetically speaking. 98% like most rats, as you know. So, but the exciting news is this, where you can't change your DNA. It's hardwired. It's the architecture within your system. You can modify your genetic expression. That's the really exciting news. This has to do with proteomics. This has to do with epigenetics, the coding that sits on top of your DNA. But here's, again, to reiterate, the exciting news is that by virtue of what you do in your life, how you live your life, how you manage your stress, the supplements you take, and saturating your system with EPA and DHA, you can seriously manage the genetic expression in your body. Not all 24,000 genes, of course. EPA and DHA from fish oils inhibits, in particular, now we know, certain gene sequences that control for interleukins or cytokines. These are the chemical messengers in the body, of course, which tell the body to become inflamed. And inflammation is a good thing, by the way, in the acute sense that it causes redness or swelling at the site of an injury. It tells the body, let's get in gear, let's get in motion, let's call out the reserves, and let's kill this bacteria, virus, or fungus. When it stays too high for too long, that's disease, that's chronicity. So knowing the genetic and nutrigenomic predisposition of an individual can help us create plans, protocols, both supplementary, lifestyle, as well as nutritionally, to help them dampen any negative genes they might have within their system. It also, by the way, modulates fat metabolism, and that's what a lot of folks are very interested in as well, fat metabolism. There's certain genes, by the way. Anyone heard of the fast twitch muscle? We're talking about muscle twitching with hummingbirds and rattlesnakes, but there's an FTO gene, essentially. Some of us should be lifting weights. Others should be running marathons. There's genes that dictate what kinds of exercise we'd be better off doing. In both cases, taking essential fats and some antioxidants after the fact help to rescue that inflammatory system, prevent degeneration of disease. Typical lab that I would run on a patient, this is a genomic panel. You can see ILB, which stands for interleukin, or tumor necrosis factors, those interleukins. These are all inflammatory molecules, but there are genes that encode for how much they're produced in the body, and some of us have the mutations, and those mutations mean these genes are going to be overactive. If we knew what those were in our bodies, then we could act accordingly. Compliance would go up, and that's what I see with my patient base. When I run genetics, and I say, wow, you have an inflammatory gene. You've heard of inflammation? Oh, yeah, it's a buzz term of the day. Well, you have a gene that says make 10 times more of it. You want to take some fish oil? And they're compliant. That's nutrigenomics. Not all of us have the ideal genes, though. So Scanusa is a little island. I'm not all about fish oil. I love a BioMarine source. Again, I think this is an untapped area. I was in Scanusa, a tiny little island off Greece, and you can almost see Turkey from there. Swimming around, investigating macroalgae, and in particular one called Posidona oceanica. Found it very interesting because some preliminary research shows that the concentrations of a very strong anti-aging antioxidant called chicoric acid is found high within that. We have subsequently sent these samples over to the NRC, where my good friend Bob Chapman showed me around, and I had some really good experience there. Phenomenal things are going down there in terms of research, both in private and government-funded sectors. And anyways, we sent a sample. We have yet, the jury's not yet out as it relates to, or rather in as it relates to the chicoric acid level findings, but we'll soon find out. I've got a quick video to give you a sample as to my experience there.
Up until now, health-conscious consumers have been aware of the many virtues of blue, green, brown, and red algae, including spirulina, chlorella, kelp. You may have heard of bladderwrack, red marine, Irish moss. They're all superfood algae. Sea vegetables that grow right here off the shore of Scanusa harness the most powerful energy in the solar system, our sun, transforming light into energy and other micronutrients. Our body can use these rare nutrients to help prevent disease and optimize well-being. Formulas found in nature are almost always synergistic. Sea vegetables are no exception. They convert sun and ocean minerals using chlorella, and the powerful mechanisms result in one of the world's most super powerful foods. The miracle sea vegetable, found here off the shore of a small island in the Aegean Sea called Scanusa, is known as Posidona oceanica, or otherwise known as Scanusa white algae. Its name deriving from the process with the sun on the beach as it hits it and dries it out, taking on a white color. We've been aware for some time now of the antioxidant power, anti-inflammatory effects, and even pH balancing ability, and overall mineral-dense nutrient profiles found in algae. But only recently, new research conducted just across the Aegean Sea in Turkey shows us, kilometers away in fact, that breakthrough discoveries are occurring. This particular sea vegetable is proving to offer health benefits some may deem miraculous. In fact, this exciting new discovery reveals an isolated ingredient in this white algae known as chicoric acid, and scientists describe it as having powerful immune-enhancing properties. Chicoric acid makes our immune cells more efficient in attacking intruders by promoting phagocytosis, and this is a process where white blood cells attack and destroy pathogens. In fact, chicoric acid also stimulates healing of wounds and reduces inflammation in arthritis and other inflammatory conditions, and increases the production of interferon, immunoglobulin, and other chemicals which are key for the immune system. Studies indicate that chicoric acid can inhibit the penetration of viruses in cells, and it also acts as an antioxidant, preventing the oxidation of collagen and cells, making it an incredible antioxidant and anti-ager.
And in fact, chicoric acid is something known to be quite high in echinacea. But we're excited to find this in sea vegetables now. So once again, it's a perfect example as to how all these isolated, ingredients are becoming a little bit better known, and we could probably harvest them out of the ocean. We know we can in a far more cost-effective and less environmentally impactful manner. So we'll go back to the slides, guys. Thanks so much for that. I also failed to thank all the organizers as well as the NRC and Ascenta for bringing me out. I appreciate that so much. A wonderful group to be able to speak to. So I would like to talk to you guys a little bit about MyStatus. This is a company that I started. Oh, there we are. There I am. I was geeking out here at the NRC, by the way, on the right. I was all excited about a biomass spec, one of the new devices they have there to isolate ingredients. Yeah, getting excited with hairnets. Awesome. I started a company called MyStatus in order to leverage really the exciting technology that exists within the clinical laboratory world, taking that science and bringing it to you, the end consumer, and being able to test you and your bioparameters for virtually anything, antioxidants, minerals, hormones, neurotransmitters, but most importantly, and this is really something I want you to all take away and share with your friends, not just the fact that I've created this company, but this technology exists, testing yourself for omega-3 fatty acid levels. Okay, it's all about the membrane. Deep within your body and trillions of cells there, the membrane is saturated, of course, with DHA and EPA. And that allows communication cell to cell, okay? And receptors which line the phospholipid membrane are very important for protein mechanisms to engage between cell and cell. And if that's not kept in, sort of that structure is not maintained, the body, nothing works well. So if you take any human cell and you throw a signaling agent at it, if that phospholipid membrane that encapsulates that cell, if that's filled with hydrogenated fats and trans fats and arachidonic acid, which is very pro-inflammatory, at least too much of that, well, the signaling agent can't get through. So that's just a missed opportunity for that cell to communicate. However, if you line it with its saturation of EPA and DHA, what's the magic number? How full should our red blood cells be in EPA and DHA? Less than 4%, remember, you're at risk. More than 8%. Thank you so much. 8%, and those signaling agents have no problem getting through like it's nothing. That's the desirable range. Remembering again, higher than 8%, and your chances of cardiovascular disease is reduced by 90%. Okay? I'm also a clinician. I thought I'd share very briefly to end off this with some very obvious and observable clinical outcomes using essential fatty acids and antioxidants like sea vegetables. This was a case of cystic acne. You can see before and after, 3 months. This case of pretty, morbid, rosacea. It was a very chronic case, and that was before and after about 4 months. And this is when I mentioned therapeutic range. Therapeutic range for me is about a tablespoon twice a day, all right, of fish oil, containing, in most cases, a 3-to-1 ratio of EPA and DHA. Okay. Psoriasis, and I mean, anyone who knows anything about psoriasis, one of the most stubborn skin conditions to alleviate, and this person, appreciating we also manage some of her food sensitivities. This is within a 4-month period at therapeutic range of essential fats as well, higher in EPA for the inflammatory factor. This is a different patient as well with psoriasis. You can see the reddened margins are still there in the lower picture, but it's a significant improvement. If we're managing, and once again, first-line therapy, why, UVA exposure to further her aging, why, major topical corticosteroids. I mean, fish oil does it on its own at therapeutic range. Ways I use fish oil, I like to get up to some shenanigans, crazy things like ultra marathons. That's how I manage the inflammation at the end of the day. The Tough Mudders. Anyone do a Tough Mudder or heard of Tough Mudder? It's making its way around the world, yeah. The only thing I didn't appreciate about this was getting electrocuted. Everything else was pretty fun. Didn't say, like, run through fire, fine, but electrocution, no. It's not good. I don't know how many brain cells I killed in that one. Thank God for the DHA. 235 kilometers across Costa Rica. I don't think I could do these things. I'm not by nature an ultra-marathoner, but they're well managed, I think, with my ability to supplement at high doses. Climb Mount Kilimanjaro. Like the sign? All right. So don't just take my word for it, of course. There are a significant, as you probably all are very aware of, body, conglomerate of World Health Organizations and bodies globally that make very specific statements and health claims as it relates to the use of omega-3 fatty acids. So once again, how many of you are supplementing right now? How many of you will and should be supplementing? Come on, guys. All right, let's start it up. Now, this is the most frequently asked question of all, of course, doing a lot of television and in clinic is, what do you take? All right, so appreciating, again, there's so much diverse life that exists within the aquamarine and biomarine environment. One of my favorites, because it really is so high in DHA, I happen to be a squid head. That's all I have. Thank you.